Welcome back to Beaufort County News and Views. I'm Catherine Glover, and I'm the director of the Washington Beaufort County Chamber of Commerce. And I'm speaking tonight with Dr. Cheryl Scott, and she's with Dirks Chiropractic. Welcome back.
Oh, it's great to be here. I brought my spine.
Yes,
so
well, they're always fun
you,
to have.
I can show you a little bit about what we were talking about, alignment. And if you can see, if you look how these are the bones in the neck, and then these are the bones.
Wait, hold up. Where's the neck?
Right here.
Oh, that's the neck. Okay.
And then they change shape a little bit. Do you see how it changes shape here? I don't know if you guys can see
yeah.
it. And this is the bones of the thoracic or the mid-back, and the lower back is down here. And this would be your sacrum or your tailbone kind of area. And if you look there, like I said, they're shaped differently because they have different purposes. So when you're thinking about your neck, it usually moves in rotation. And so the bones are shaped to move in rotation, where if you look at your thoracic spine, not so much. They're more for flexion. And then the lower back is rotation and flexion. And so what we do as chiropractors is we assess, if the joints are moving properly. And then we do very gentle, minor adjustments to restore that motion.
So how do you know, when you assess somebody, how do you know? I mean, they obviously come in and they've got some sort of pain, which is coming from something. So how do you know when you assess them?
I have a complete line of orthopedic tests that I do, as well as I touch every single vertebra to see its motion.
You touch it like through the body? You can
through
feel
the
it.
body, yeah. Like when your chiropractor's rubbing your neck, or it feels like your chiropractor is rubbing your neck, what they're actually doing is assessing the motion in each segment, or they're feeling for a part of it that's not aligned.
Okay.
So that way they'll know where they have to do the specific adjustments, because I know it sounds like you're getting like the chiropractor cracked my neck, but honestly what they're doing is they're doing very minor adjustments to a single individual segment at a time. And so what we do is they may rotate your neck a little bit, and then for the mid back they'll feel and see if these are aligned. You can see if a vertebra is out of alignment, say in rotation, you can see where that would be a little bit off. And all we would do is do a gentle push to kind of put it back in place. And then usually for the lower spine, it is in flexion and sometimes in rotation. But if you feel along the back, you can see. It's not just the bony kind of areas that we're feeling. We also feel tight muscles in the area. That will also let us know which areas are of concern.
Because basically, and you're taught and everybody else, the world, they're all connected. Right? I mean, that's... One thing leads to the next and leads to the next.
Yep, the bones themselves provide the structure, but it's the muscles, it's the muscles that actually do the moving, and it's the nerves that give them the information so that they can move. So everything works in concert.
So what would somebody expect if they came to your office and they're like, I'm going to meet with Dr. Scott and this is my first visit? What do they expect?
First of all, they have to fill out lots of paperwork. I'm sorry. That's just how we do.
Everywhere.
But then when they come see me, they're going to get a complete examination. So I'm going to talk to them about when their pain started and what their concerns are. And then I'm going to examine them. I'm going to feel their spine. I'm going to do different kinds of tests to see what's going on. We'll decide whether or not they need x-rays. We can talk about that.
Do you do x-rays in the office?
We do in our Williamston office. In our Washington and Greenville offices, we refer usually to Eastern Radiology. And the nice thing about using Eastern Radiology is it's all digital. Yeah. So we get those films when you take them in Eastern Radiology.
And that's just to make sure there's not anything underlying going on, right?
Right. That's just to make sure is there significant arthritis that we can't feel with our hands? Is there some sort of nerve impingement that we can't see? But it's just to make sure if they've had a fall or a car accident, are there structural damages? There's lots of things that we want to make sure are going on before we start to do the manipulation. Because our goal is, or at least my goal, is to make them feel a little bit better each time they come in, and that's what they can expect. Often we'll do therapy first.
And then you say therapy, what's that?
That would be heat or ice, and then electric muscle stimulation. And I usually don't adjust on the first visit because, number one, I want to look at their x-rays. And number two, I want to see how they respond to the therapy. That gives me a lot of information about what's going on with their spine and what's going on with their condition. And then when they return on the second visit, we'll start the chiropractic manipulation, but it's really, really gentle. I want to stress to your audience that my hope as a physician is that you get a little bit better each time, and we move kind of slowly for that reason.
And heat and ice are really two good therapies that you use, but what'd you say the other one was?
It's electric muscle stimulation. Is what you get. It's significantly stronger than a TENS, but it works on the same philosophy. We put electrodes on the areas that are of concern, and then we modulate the frequency until the patient feels it and is comfortable. And it helps to relax the muscles.
Right, and that's just that's not, you don't go under the skin. That's just putting it right on the skin.
That's right on the skin, yes.
And that way that they can, then the heat and all of that together. But then
it feels really good. We want them to be comfortable.
And that's a great way to do that. So that's on your first visit. How many, you talked earlier about if they were going to get better, you would see that in 2 weeks.
In 2 weeks. That's what we usually tell. I tell almost all my patients. For our car accident patients, it's a little bit different because they've had a significant injury. So we talk in the 4 to 6 week realm. But for people who have just aches and pains, I say, I'd like to see you a couple times a week for 2 weeks. And then you and I will sit down and have a conversation about how you're doing, how you're feeling, and what we need to do moving forward. Is this therapy working for you? Is it not working for you? If it is, do we need to back things off? Do we need to increase your therapy? It's very much individualized.
Okay.
And we can definitely see, like within a 2 week period, if what we're doing is working.
Great. We're going to take a quick break. We'll be back in a minute with Dr. Cheryl Scott.